Good evening, depending on where you are in the world, and thank you so much for attending this month's educational webinar. We have Dr. Nahla Afifi sharing her time, her expertise, and I guess some directions and probably lessons learned about the Qatar Biobank for the next hour. But before we start, I just wanted to introduce Dr. Afifi, who earned her medical degree with honors from Ain Shams University in Egypt, continued to Masters of Anatomy and Embryology, and specialization and Diploma of Gynecology and Obstetrics, also from the same university. She then went to do her Ph.D. also in Anatomy and Embryology with the joint supervision with University of Medicine and Dentistry to New Jersey. She then continued as a medical researcher in the Department of Pharmacology and Toxicology at the same university in New Jersey, and then returned to Egypt as an assistant professor of anatomy and embryology, both in Ain Shams University and Dubai Medical College for Girls at UAE. She has been, I guess, Dr. Afifi, correct me if I'm wrong, spearheading the biomedical science program from 1999 and promoted to full professor in 2007, head of Department of Health Sciences till 2009, and then joined as the education and scientific manager, and later on the Qatar Biobank Director. So really a lot of expertise and a lot of guidance that I guess we can hear and implement across the other cohorts. So Dr. Nahla Afifi, please welcome, and thank you so much for dedicating your time. I'm not going to give any details of what is about to come because we are all much looking forward to hearing about the national population-based biobank that you are leading. So welcome. And thanks to everyone for attending the seminar today.
So thank you very much, Alexandra, for your nice introduction and comprehensive introduction. And also thanks, Latifa, for organizing this session, for providing for me to give a light on the Qatar Biobank and presenting the milestones of Qatar Biobank to support the precision medicine initiative. I will try to share my screen. Do you see my presentation?
Yes, we can. So if you just put it in a presentation mode, I think
yes,
that would be great. Yes, absolutely perfect. Thank you.
So I will start that to introduce Qatar as generally, Qatar is a small peninsula in the Gulf region and in the Middle East, and with the total population, for that, with the total population which is around 2.7 million local Qatari, the local Qataris are representing only 12% of the population, which is around 300,000 residents, and the rest are expats are coming to work in Qatar. So this is reflected on the structure of the population, as you see that around 75% of the population are male and 25% are females. Qatar, so in 2009, a famous article for presenting in the Times indicating that one of the 10 great ideas which will change the world is establishing biobank. So that this provides the decision maker in Qatar to establish a Qatar Biobank. Qatar Biobank was established in 2012 as a medical platform to provide the tools for implementation of precision medicine and personalized healthcare for the benefits of people in Qatar and also in region and worldwide. So currently in Qatar Biobank, we have 5 initiatives. The main initiative is the cohort study, where we are planning to recruit around 60,000 participants, which resemble 20% of the population, Qatari population, and long residents. The long residents who stayed in Qatar more than 15 years, adult, male and female, and we will follow them every 5 years. I will explain about the cohort study later on in details. The second initiative we have is the MRI initiative, which screening, we will do a screening for the whole body and the brain associated with the cognitive test. The third initiative is the cubic study. The cubic study, where it is Qatar birth cohort study, where we are planning to recruit 3,000 family trials. We recruit the pregnant female at the second trimester, follow her at third trimester and time of delivery. Then we follow the baby until 4 years old, and we invite the father to participate at any point of the study. The fourth study, which is we recently established, is the COVID biorepository with the 3 arms. We have the vaccinated, we have the disease arm. We collected samples and data from the first wave, second wave, and third wave, and also vaccinated arm where we collected samples and data before the first vaccine, then before the second vaccine, then after the second vaccine by 2 weeks, and follow the participants for 1 year. The fifth initiative is a tissue biobank, to establish a tissue biobank. We did a gap analysis because it will be collaboration with the hospital, and we are waiting for the funding and hoping that we will start next year. We identified that we will start with the 2 cancer types, cancer breast and cancer colon, as these are the most common cancer prevalent in Qatar. Those all initiatives are supported by Qatar Genome Program. We're responsible for the whole genome sequencing of the participants who are coming. The logistics for the whole genome sequencing of all participants are coming to the biobank, and also with linking the biobank. This is the second initiative, is linking the biobank into the medical record bank with the Cerner for sending the samples and receiving the data from the hospital. So to start the biobank, we started in several phases. We didn't start as one directly as mature for the cohort study. We started the first phase with the pre-pilot phase, establishing and assessing the questionnaire, and with minimal measurements, biometric height and weight, validating the translation of the questionnaire as we provide the questionnaire in Arabic and English, validating the Arabic version, and then setting the recruitment plan and how we will approach the participant in Qatar. Then we started the pilot phase. We will start to collect more comprehensive measurements, and also establishing developing and implementing the IT infrastructure, and reviewing the protocol after the pilot phase. Then once everything is ready, we started the ramping up stage. We started at the beginning in the biobank accepting 1 to 2 participants per day in 2012, end of 2012. Then we reach now to 36 participants per day. The Qatar Biobank-VISIT, the participant, when they come to the biobank, everything is collected electronically currently. Before it was, of course, we started with paper-based, but now no paper at all. We start after the registration and consenting the participant. Our consent is a broad consent, allowing us to utilize the data and samples and relinquish the right to the biobank from the participant. Then after the questionnaire, we will start the nurse interview. The nurse interview is related to the medical history, dietary questionnaire, and also the lifestyle questionnaire. Then we have to collect measurements. The nurses are doing that blood pressure, standing and sitting height, spirometry, grip analysis, ECG, and Vicorder for stiffness of vessels. Then we have a fitness test, retinal image, and then we collect the blood, urine, and saliva in the biobank. And then it goes to another room where we do IDEXA and for bone density, muscle and fat, and then we do retinal scan. And we have an eligible questionnaire. If the participants are eligible to go to the MRI, we book them another appointment for MRI and cognitive test. This visit, it takes around 3 hours, but we were worried at the beginning for the length of the visit, but as you see, they are moving a lot, and by this, the participants, they don't feel the time when they come to the biobank. For the blood collected, we collect around 60 ml blood. We divide the blood, half of the blood we fractionated and store it into 3 identical plates, where we have one in -80, one in -170, and one in remote distance for disaster recovery. The other half of the blood, we send it to the hospital where we measure 66 biomarkers for the participant and give them the results after 2 weeks. The MRI study, as I mentioned, the eligible participants, they come to the MRI. We do the brain, we do the whole body, and currently we added also corneal confocal microscopy and vibration sensory test with the collaboration with Weill Cornell. Then we do for the ChemTab test, for the cognitive test, we do for attention, psychomotor speed, executive function, and episodic memory. At the end of the visit, we give them a report only showing that what the performance without any, because it's research, and to activate how many hits they have, what is the performance, and that's it. For currently in the biobank, we succeeded to have around 35,000 participants, and we have the dashboard that give us the data every 24 hours, and most of the participants are young, between 28 to 45, so with average age 40%, with around 50% female and 50% male. So the journey is not an easy journey, as I mentioned. At the end of the results, as I mentioned, that the first once they finish the results, the visit, and we send the blood to the hospital. After 2 weeks, we invite them again and give them the results through the medic's office. We have a physician on site. So we were expecting that the participants are coming voluntarily. They come to the biobank supposed to be healthy. Then we found that more than 54% of our participants needs to be referred. The most cause of the referral due, as we do IDEXA for all the participants, is due to osteopenia. Here, as you see, and the red bar is the new cases. They didn't know that they have a disease. The blue one is for the old cases. So the second one, these are the most of them, as I mentioned, due to osteopenia. Followed that we have diabetes and hypertension and thyroid function tests. As I mentioned, the journey wasn't as easy. We have to identify that we had challenges, and we need to overcome these challenges through our journey. By this year, we will celebrate the 10th year of establishing the biobank. As we identify that the first challenge we have from when we started the biobank, that we have to assure the public engagement and the communication with the public to come to the biobank. So we started at the beginning by doing a questionnaire that to measure the perception of the participants in Qatar either they are Qatari, as we are targeting Qatari and long residence. And there is a variation of the perception between the two groups of participants. So the Qatari nationals were excited by the idea, and the appealing concept for them when we did a focus group and a questionnaire, that they have improving the main idea, the concept is improving the health of future generation, and it worthy and character and especially for charity causes, and develop and raise the status of Qatar in the world, the community, and international prestige. For the main barrier at the time that they are fearing, there is a fear for spread of disease, more worried about the privacy and confidentiality and the time convenience. So although also for long residents who stayed in Qatar more than 15 years, they were more skeptical and less enthusiastic than the Qatari for the idea of the biobank at the beginning, because their concerns that few personal benefits of biobank for them, and it's they under impression that it is Qatari centered and it will not give them any benefits. And they are worried also around the privacy and confidentiality, and that they have a greater concerns surrounding the time and convenience. So to leave their jobs and come to participate in the biobank. But the appealing concept was eradication of disease and improvement of the general health and society, improving the health for future generations. So we have to design the message for the targeted population according to their feedback. So we identified that the Qatari population, they are easiest target than the long residents. So that especially when give them the message that it is important to participate for steering the development of Qatar. It is an international prestige that Qatar we have a leading biobank, and for the health benefits. For the message for the long residents, it has to be improving in general health society, improving the world of future generation. This is very important that we also identify that for recruiting participants and advancing participant engagement, we have to use the social media. We have to have campaigns. We have survey for getting their feedback, and we have to have influencers through the social media. One of our major influencer is Her Highness Sheikha Moza, and as you see, when in 2015, when we opened the biobank for ramping up the new building, she visited the biobank and she went through the biobank. And from our website, the hits of the websites is like in 2015, in February, when she came, it's reached a number which never expected, and we never reach it again all the years, 360,000 hit at the biobank. We also, of course, we have identified in the country, there are social influencers. You'll find that when we reach numbers more than 5,000 or something, we reach 10,000 depending on the social. These days, a lot of media campaigns is done. We have a participant feedback about the visits, and also we do that after the first visit, and once they receive from the results from the medics, and we find that more than 90% of the participants, they rated their visit in the biobank as excellent visit and very, very good visit. So the second challenge which we identify, and every biobank needs to do that, the technical and operational best practice. As Biobank, we need to, at the beginning, we have several meetings with identifying our partners and our customers, which is mentioned in the management, that our customers are three, that we have the participants who are come to the biobank. We have the researchers who will be provided by the samples and data, so we need to understand their needs, and also with the suppliers who will provide us with the expertise and the equipments and maintaining our process. So the QB, so those are our stakeholders. We need to collect from them the feedback and the requirements for our service to be provided. So we have the business model, we identify the scope, we need to have the technical and operational best practice, the ethics, which is regulating, and the policies regulating the biobank, and also the safety best practice for our staff and the participants when they come to the biobank. So we followed the PDCA plan. As you see, we have a plan. We have several meetings and several efforts we did for planning. Is very important, starting with the planning that we have to, for the process design, the process interaction between the different departments is very important, this step, and production of the service specification and risk analysis. Then we follow for the implementation that we have to identify the like the training for all the staff, what is the training needed, and the installation of the process and the data which is be collected. Then we assess through the documentation, the validation, and the competencies of our staff. Either they are nurses, we have also lab technologists and the physicians, and also the IT team supporting. And we have to set a KPI for each department. Then we follow that, of course, with a review for the action, for the improvement and the process redesigning, and if we need a new process. So for that, we followed all the international implementation or international requirements. We are ISO from the beginning. We went for ISO certification for the QMS and also for ISMS for information security to assure the participants the security of the data. Then it was renewed in 2017 and 2020. And also we went through the ISO for the QMS and ISMS, we identify that there are certain common areas. So we decided to have an integration management system as the common areas between the two ISOs will be one documents, so to avoid duplication. And now currently we are CAP accredited for the lab for processing the Q-chip. And also we are going for the ISO Biobanking 20387, and hoping we will have the audit next month, and hoping that we will pass that, and we will be one of the first biobanks in the Middle East, the first biobank in the Middle, hoping that once we accredited for the ISO Biobanking. So for the lab part, it is very important that where we have the core business, that we need to identify when we started the biobank, what are the challenges and how we will overcome this challenge. The challenges which we identify, yes.
این بچه خود حالش بد شد، دیشب بردیمش بیمارستان باز. حالا امروز بهتره به حمدالله. آره اون عفونتی که داشت و تب اون به حمدالله کاملا خوب
Sorry, I think we
شد.
have somebody who is not muted. Would you mind muting yourself?
که برای اون اسهالش الان بردیم به حمدالله، حالا اسهالش هم بهتره.
Hi.
آره دیگه.
Yeah, I think Dr. Reza, Please mute your mic.
کجا آجمه کجا هستین؟
I don't think
به سلامتی به سلامت.
I can't do it from here, Latif. I don't know whether you can do it on the screen.
Be able to do it because you have first capability.
بسیار خوب. قربانتون برم.
I'm gonna text him.
Scott,
خیلی
you
ممنون.
be able to know your license your host.
خیلی ممنون. خداحافظ.
Okay, so now we come. So this for the challenges, as I mentioned, that we need to identify what will be the challenges if we have identified that as we started, if we will get multiple studies and multiple process and the data which is stored, how we will do that. We need to identify that the needs of the human resources and also for traceability and documentation of the samples and the process, and that we have precious samples. So that's why we have a triplet of the samples to be stored. So we identify that overcome the multiple studies. So it has to be the IT team. They have to support us with the collection and designing the study design support with the information system, with the IT team. And also for the human resources, we identify the workflow automation, which can be automated and to overcome the lack of the expertise or the personnel. And also for the traceability, we have to follow the quality management system tools. And for the precious samples that, as I mentioned, that we have to have and backup and also notification and critical step for monitoring these precious samples. So when we started the biobank, we started in manual, only one centrifuge and manual case, but now with multiple studies, we, as I mentioned, we need to have the automated robotic system. Currently, we have that to support the multiple studies and also the traceability and the quality of the samples, which is collected from different studies. So we have the automated robotic system supported by the information for the LIMS system, laboratory information management system, for starting from blood fractionation, DNA and RNA extraction, DNA and RNA quantification, cDNA system with purification, for live cells, cryopreservation, and also we have the lab chip microfluid nucleic acid integrity quality control. We do DNA fingerprinting and gender determination for traceability of the samples. We have the Q-chip, the microarray Q-chip axiom process, which I will explain later on, one of our achievements. Then we have the storage. As I mentioned, we store in -70. Automation, and we have also the -80, sorry, and we have the liquid nitrogen cryopreservation for -170 tanks. We have 8 tanks in the biobank. So the third challenge which we identify is the coordinated, the IT infrastructure and integrated of internal and external system. When we started the biobank, it was a simple plan that what we need only that we will segregate the data. We collect the personal information. The data which is collected, we will put them in 2 different servers, and that after 20 hours, that the personal data is one server, and the second is the questionnaire and the collected either and the biometrics and samples and results in second server. So we started with this under this plan, but now what we have is this, and this is the short one, which will, I will explain how complicated that. In Qatar, Biobank, we collected in a closed for avoiding any, for the confidentiality, it is a closed system within the biobank that we have to have a system starting from the booking of the participants through our website, then registration when they come to the biobank, then to this where we have the identified information, then de-identified give the participants a code, a clinic code, where the participant codes, where they go through the clinic after collecting, starting from the consenting of the participant and all the measurements within the biobank, as I mentioned. All of this is collected electronically, even the signature of the participants. Then the samples which is collected at the visit, it has to go to the lab, processed through different lab process with the LIMS system. And the other half of the samples, as I mentioned, it has to go to the hospital. So we have to trace these samples to the hospital. And once they analyze in the hospital and the data of the 66 biomarkers, they have to return back to our medical office to assess the results. With the data which is collected from the visits, they have to go to a MRS system, which is the medical record system. So our physicians, they review these results, and then they have to inform the booking team again to call the participant to come for the second time to collect their results and sit with them and have another appointment. So all of that is related to the participant. Then it comes to the research portal, where the research portals that the researchers will register through our website for and submit their proposal, and then we have to look at the data and provide them of the data. This is the closed network, but we have to identify that we have to have air gap portals where we have to maintain our equipments, and also when we send the samples to the hospital, and also we have to be linked with several business continuity sites, and the data which is collected, either structured or unstructured data. So all of this data, it has been collected. And at the time when we do for providing the data to researchers, especially, we have to spend a time for extracting. Is not the most difficult. Now we discover that it is not collecting the data, is extracting the data in structured way. So we did before we took time to extract manually the data. But now we currently this year, the first phase of the data warehouse, which wasn't an easy task at all to be automated for the extraction of the data every 24 hours, we do that. So we have to identify the data sources and from different equipments, and they have to process it. Then the IT team, they worked hard for that. Then they integrate the data at the warehouse. Then we identify that we have to reporting and analytics platform which built on this integrated data warehouse. So the first stage which we identify is working as on research legislation to ensure that medium and large research in Qatar to be coordinated with Biobank. So when we start with not only that the Biobank for storage of identified the storage of samples and data, but we are worked hard to establish the Biobank as omic platform in addition to the phenotypic data. We started with the whole genome, with Qatar Genome, which is responsible for the whole genome sequencing with CIDRA for the participants. Currently, we have more than 20,000 whole genome sequence data available to the participants. Then we have metabolomic data. For the first 3,000, we have epigenetic data, we have proteomic data for the first 3,000 participants, and also transcriptomic data available for participants with collaboration of the specialized institutes in the country. So we outsource them, they do the analysis for us, and we keep the data available for researchers. So it is important for the research portal. We have, as I mentioned, that for researchers, we need to identify the process and also the monitoring system for the researchers. So we already have a system for the research access system through our website, where the researchers, they send their query and we reply to them, and then they write an application form, goes to the access office. The access office reviews the requirements if they need, and we have IRB committee in the biobank for approval of the research project. Then they communicate with the researchers, sending them all the requirements and closing the study once they finish and publish their study. So currently, for the research, our research office received more than 300 applications, and we have more than 70 publications in international journals on our website. And we support student research, PhD student, and master students, in addition to the granted researchers. We have an inclusive approach that most of the institutes in Qatar, they submitted to us proposals. They know about the biobank currently. Starting the highest one is the university, Qatar University, while Cornell University and Sidra Medical City, and also HMC, which is Hamad Medical Corporation. So the last challenge which we identify, of course, the budget and sustainability of the biobank. So it's very important that we collaborate with the different institutes, as I mentioned, with the main clinical medical institute in Qatar, which is the HMC. They trust the biobank, and they identify that in the report that it is very important to support the biobank and for it considered as a development asset, and that they need to establish the tissue biobank. So they allocated the biobank to be responsible for establishing a tissue biobank. And also that as our role for sustainability, we shifted through the COVID biorepository. We have this capability of shifting our process already because there is no participant coming to the biobank. So we decided that to start a COVID biorepository, we sent our staff on sites. Of course, we designed the first disease arm of the COVID, where we sent our staff to collect samples and data from the COVID patients in the hospital, and also from preservation area at the first wave and second wave and third wave. And then we collect samples through there when they are sick at the time of disease on weekly basis. Then we follow them for 1 year. And we collect samples and data. We have a questionnaire about the severity of the disease and the symptoms at the time of the visit. This provides us with the experience of collecting everything electronically and connected with the biobank from different sites outside the biobank. We collected samples. Also, we went on sites, different sites for vaccine. We collected, after consenting, of course, the participant, we collected blood before the first vaccine and collected the second before the second dose and 2 weeks after the second dose. Then we follow them quarterly for 1 year. Already we finished this study. And as a biobank was identified, which is a great achievement, that by the Ministry of Public Health, that we are the center of excellency, that we were responsible for distributing, especially for traceability of the samples, distributing the samples all for the different centers in the country for sequencing the virus. So we have a copy from all samples at that time till now, that residual samples from the nasopharyngeal swab to trace the strain of the virus. We are proud with the achievement with Qatar Genome that as the outcome of the first 6,000 participants, the whole genome sequence, that we established the Q-chip, which is Qatar Precision Qatar chip, the first chip that microarray with the partnership with all the institutes, HMC, Weill Cornell, and etc., which will be used for diagnostic of rare diseases and also can be used in neonatal screening. We have a project for assessing the Q-chip for that, and for premarital testing and pharmacogenomics, and also for research. We will have one version for the medical diagnostic and one version for research. That's why we went for CAP accreditation, and we successfully processed this, achieved this, and it will be run in the biobank. The second initiative was also success as outcome of the whole genome sequence with Qatar Genome Program, is establishing a wellness report, which is give like a sense of what is the utilization, something like, it is not like diagnostic, it will give their lifestyle and wellness genomics about the food metabolism, the weight management, and the response to exercise. Then this is the first phase, which we finished the first phase of 1,100 participants receiving the report to see the acceptance, to assess, and the feedback of the report. And there is a study by Qatar Genome if it will change the lifestyle of the participant or not. So then the next phase, of course, it will be for pharmacogenomics part where Qatar Genome for the cardiovascular disease, diabetes, and pain management, this will be the next phase. So it is very important that to build a trust with the higher authority and to have to assure the sustainability of the biobank. So this is a challenge of the sustainability of the biobank, and especially that the budget is coming mainly from outside, from Qatar Foundation. So we have to prove to them the importance of the biobank. So in conclusion, that it is important for a successful biobank to have a clear process and identifying the best practice for technical and operational activities, that Qatar Biobank achieved to develop a coordinated and comprehensive framework engaging the public, local authorities, and research entities to work together toward the discovery and development of the evidence-based novel healthcare intervention. So I would like to acknowledge and thanks my team. So as you see, when we started with only this small team as when we opened the new building, which is 2015. Then we grew, and now we have around 70 staff is running the biobank. So thank you all for your for attending this session, and I open the question, and I encourage everyone to go to our website and check what we have in the biobank and try to apply and for any collaborative project. Thank you all.
Thank you very much, Dr. Afifi. That was a very insightful presentation. I think you have probably answered most of the questions that I have had, but maybe I can start with a couple and then I'll open the floor to others. So I think you do collect a lot of data when the participants come, and my question was about the distribution between male and female, and it seems that you have more or less 50-50%, but can you just let us know what is the age range? Is this only for adults? Are there any work in children? And in a way, what is the, I guess, the age of the oldest participants as well?
So yes, the age we only target for the population study is 18 years old, the adult, and unlimited. So we have participant with 80 and more 80 years. So as long as they are adult, for consenting the participant in the cohort study. For the COVID, we have the essence. We recruited children at the COVID study. And also for cubic study, we will follow the child. But for now, this phase, we recruited mother's father, and we follow the child with questionnaire from the mother. But we didn't collect any samples for the child. But we have the IRB approval for collection from children until 4 years.
Right. Okay. So I guess a question on the healthy aging and whether you can look at that in Qatar and whether there are any markers because you're collecting lots of data. But I'll give over to Rongling has a question. So Rongling, please.
Thank you, Dr. Afifi. That's nice presentation. It's very informative. My question is related to your pharmacogenomics project. You have specific focus on the cardiovascular disease, diabetes, and other diseases. When you do the pharmacogenomics, genotyping or sequencing, do you return the results to the patients to guide the clinical applications?
For the genetic, no. We said that now currently, that's why we did the pilot phase for the wellness report, as this is a result. The wellness report is a result from the genetic analysis. So when we have the consent in the first phase, we said that we give us the permission to do a genetic testing, but without returning the results. Then recently in 2019, we changed the consent to add the option if they want to receive any like the wellness report or other phase or any actionable. This is very important that in future. But for now, we only give the pilot phase for the wellness report because for giving genetic data, it is very critical. We at that time, and we have to be sure that it has a process, and especially for IRB. We started a pilot phase with especially with the BRCA1, BRCA2, because after the first 6,000 participants, there's a published paper identifying that we have a participants which they carry the BRCA gene. So what we will do with them? So we agreed that we will do a pilot phase. We reconsent the participant again with the medics from HMC, Hamad Medical Corporation. We will invite them because we were so worried with the perception and how we will call them and what we will, the ethical part of that. So we call them again as the second visit because they already have 5 years, and we offer them, do you want to participate in this study? And especially they were male also with the physician and also genetic counselor at that time. So the people who accepted to participate in the genetic for the BRCA for testing, we have to confirm the results. We collected blood, send it to the hospital, and they double check because at the first it is a research result. Now it has to be clinical result. And it confirmed that all of them, they were positive again with the BRCA. So, that the hospital will be responsible for following them. So they inform us. So we are excited with this. It will be published soon, this process, and how we will link all of that with the participants, because we were so concerned. We have to double check from the biobank the traceability of the samples and to be sure that those are the participants, calling the participants, then the logistics for following them. It's because if we tell them you carry the BRCA gene or something without any direction or something, it's ethically challenging. So even now for the IRB committee, they decided that any project which will use the data for genetic data and to find, and they are looking at disease, they are the researcher responsible for putting the logistics. If they found this, how we will inform the participants and how we follow them. The advantage in Qatar that there is one medical system and there is a hospital, the Hamad Medical Corporation, which is responsible for all the hospitals there. So it's easy to find a solution. It's not like a multiple or challenging system in the country.
Great, thank you so much.
Thank you so much. We have another question from Michelle Ramsey. Michelle, please go ahead.
Nahla, thank you so much for this wonderful presentation, and also for showing us the amazing work that you've done in a very short 7 years, starting in 2015, taking us up to where we are now is just incredible. So you've answered a lot of my questions, because one of them was, whether you treat the sample as a clinical sample from the word go. And I was really interested to see that you do DNA fingerprinting and a gender or sex match. Is that done when the sample goes into the system? And if you have a repeat sample, do you then redo that to make sure that the sample is from the same person?
Yes, we do that. It's very important, especially for the Q-chip before processing for the quality check, yes.
Yeah, and then Nahla, I wanted to ask you a little bit about the governance as well. And it's so impressive that you have so many collaborators and projects in place, and over 70 papers published. Is your data also open to the world at large, or is it mostly for people in your country at the moment in terms of collaboration and studying together?
No, it's open for the world in large. Now we start that internationally, but we identify that they have to have a collaborator in Qatar. So that to build the infrastructure there, and it is important. But we are open for any collaboration as long as that they have a collaboration in Qatar.
That's quite an important and interesting model, because we've tried the same in Africa, saying preference will be given to people who are also building capacity, because I think that is a way of doing that. So that's really very interesting. And then, for other people wanting to think about a national sort of biobank, what was your initial sort of financial outlay, and what is your current budget? Just in very high level terms, because one of my questions was going to be how many people are working there. So 70 people is a lot of people, and I know that you started small, but I think for people who want to start national biobanks, what should they be thinking in terms of ballpark?
So as I mentioned, when we started the Biobank, we started by 10 people only. So between 3 nurses and I, and also we have 3 people in the lab and IT people, and then we grow by days. So as a national project, that's why I mentioned it was a stand, but you have to have a support. Yeah, we were lucky that we have the support from either the board where we have established the biobank. It was a mix between Qatar Foundation, who are where we are reporting to, and getting the budget, collaboration with the Hamad Medical Corporation, and also now currently with the primary health care also. And we have the advisory from Imperial College when we started the first 3 years of the study. Once we establish ramping up, we are in our own with building the infrastructure capacity.
And then my last question, thanks for indulging me.
No problem.
We know that there's a higher level of consanguinity in Arab countries in general, are you seeing many monogenic disorders? And, you know, is that also something that you're going to focus on? Because I know you mentioned cancer and pharmacogenomics. What about monogenic disorders?
Currently, we have the Qatar genome responsible with they have an initiative with publication strategy. They identify like 10 themes of groups that they work together for the analysis of the genomic data. One of the projects is for the monogenic diseases, and I hope that it will be published soon. And for the BRCA, like the cancer, we have a publication for pharmacogenomic effect of the first 6,000, the cancer prevalence, the difference and that the outcome of this study, it's published also. That's why we went for the BRCA, following the BRCA study as general. Then we will go for the colorectal cancer. So it is already the plan, the publication strategies. This will be, I hope that it will be published soon. Yeah.
Thank you very much.
Thank you. I have another question from Hamdi Mbrek. Please, Hamdi.
Hello. It's not a question, but just to give an answer to the previous question about the monogenic disease. And indeed, as Dr. Nahla mentioned,
we can't hear you very well. I don't know whether
we have looked at the burden of disease. Yes. So we're gonna publish this very soon.
Right. Okay. Great. I know we are quite close to the hour, but maybe I can just ask you one question, Dr. Afifi, about how do you get notified of the events in the cohort? You said that you have the same system, and I guess it's national. So is there a separate cancer registry and debt certification and like administrative databases for all the hospital admissions, or is that already in one system that you have access to through the national system? Because it's 35,000 that you have so far, and probably aiming to recruit more participants. There will be individuals with different cancers and different chronic conditions that you can probably profiling already. How is that notification in Qatar?
For now, yes, for us as a biobank, we collect in close because for the confidentiality of the information in the system, close database within the biobank. But we link with the Cerner. In the country, there is a unified clinical information system, the medical information. We use Cerner in even the private hospitals, the different hospitals, they use the Cerner. And we have the access now, our approvals, the infrastructure, we connected with Cerner because we send the samples to the hospital through the system and we collect the results. And also in our consent that if the participant consenting that we will have the access to their medical records. So we receive the data in ICD-10 code from Cerner and we collect it in the biobank and keep it in the biobank. That was challenging because when we have, it is important for confidentiality of the participant that they don't know that they came to the biobank as a biobank, but we have the access to see the reports and receive the data in coded way. So this is how we work. And this was a support of, we are lucky that we have this unified medical record system in the country.
Sure. No, thank you so much. And we are at the end of the hour. I would like to thank you, Dr. Afifi, and everybody on the call. And I think Latifa has an announcement for our next webinar to follow on from me. So thank you, everyone.
Yeah, thank you everyone for your participation. I just would like to remind you, next Monday, October the 3rd, we will have the first IHCC panel discussion on genetics related to the COVID-19 cohorts. So please join us. It's going to be exciting. panel discussion. So looking forward to your participation. And thank you again, Dr. Afifi, and good luck with your audits.
And thank you. Thank you for inviting me. It's my pleasure.
Thank you.
Thank you.
Thank you.
Bye-bye.
Bye.
Bye-bye.
Thank you.
Thank you, everyone.
Thanks again to everyone.
Bye-bye.